Thank you, everyone, for taking time away from your busy schedule to participate in this webinar. And today, what I'd like to do is a cursory introduction to AI, artificial intelligence, and its particular role in traditional Chinese medicine research and education. What really matters is what practitioners and students of TCM need to know. So this is basically a introductory course. There will be additional webinars. We're planning on master classes and other opportunities for you to learn, improve your skills. What are we going to do about today? What are we going to talk about today? We're going to talk about what is AI, all the different nomenclatures and abbreviations that you're going to run into, that you're seeing all around, all the modalities, but more specifically, how do they fit into our profession, the TCM profession, both in education and research. We're going to look at how applied research differs from classic research, scientific research, because I believe, and as you'll see in the presentation, what we need to think about more about pragmatic research, pragmatic applied research. We'll look at a little bit briefly on AI in education. We want to talk a little bit about ethics, ethical and safety regulations. I will give you a do's and don'ts takeaway and very important links to what's happening in the guidelines with regards to ethics, particularly in Europe. For those of you coming in from overseas, there are regular publications for the AI regulation in ethics and safety, particularly in medicine, that you also need to be aware of. We'll discuss the right tools for the right job. AI is a tool, and just like any tool, you need to have proficiency with that tool at a fundamental level. You need to know when to use the right tool for the right job. You wouldn't use a screwdriver to drive a nail in the wall. Some of us might, but we don't know what kind of result that's going to lead to. And then we're going to, at the end, I want to close with an actual practical recorded video that I use at the college in education that walks you through a simple step-by-step, like 7 or 8 steps to take a PICO, a research hypothesis that you've created for practical application, and turn it into a document at the end that you can work on to help you with pragmatic applied research. So we'll see that in real world. A little bit about me. As Claire indicated, I'm the co-founder and dean of academics at the European Institute of Integrative Health Sciences. This is a global and very unique hybrid university. It is probably in the leading edge of implementing and integrating all these advances in technology to improve TCM education. So, it's like a unique hybrid blended institution. We offer bachelor's degrees, master's degrees in traditional Chinese medicine and other integrative health sciences. I'm the founder of Chibo, an AI tutor, which is exclusive to EIIHS right now. And it is a suited trainer, tutor, and virtual patient simulator for our students and our educators at EIIHS. I am the chair of the AI task force from the NCCAOM in the States. I am a member of the TCMA Research Task Force and a former EC, for some of you who may have seen me on the executive committee on the TCMA. I'm a professor at various medical universities, both in biomedicine and in TCM sciences, and I've authored several articles and books, most common of which is Elemental Nutrition, which is now adopted at several universities as a key textbook for TCM nutrition classes. Prior to that, I have 16 years of engineering and IT experience working for major corporations in programming, engineering, and scientific work. Now, I'd like you to meet Annie, Aggie, and Assie, the ladies of today, tomorrow, and the future of AI. Now, Annie is very focused. She's very task-oriented. She's a narrow intelligence, ANI, artificial narrow intelligence. What she does is very good at very specific tasks. She's today being used in various facilities in medicine and other environments to do searches, to do very focused screenings, quiz making, educational program making, to help speed up research and teaching. We have Aggie. Aggie is a human level intelligence, AGI, artificial general intelligence. These are your LLMs, the large language models, and future iterations of that. They're more flexible. They're able to actually create entire concepts, whether it's a course module or whether it's an entire RCT that you want them to design. And they will give you the hypothesis, the methodologies, the implementation plan, end to end. And then we have ASI. ASI is the super intelligence. This is beyond human AI. And though today, in today's standard, we don't see a real fit for ASI in TCM, I do believe that ASI will play a major role in the ethical and humanization of our medicine and any scientific research scientific research in the field of medicine. So these are our ladies. Now, what is AI? All of the iterations, neural networks, machine learning, cognitive systems, knowledge trees, perception elements, planning, LLMs, etc., in robotics, computer vision, etc. These are all different components of artificially intelligent entities. And they have one unique aspect which really maps out very, very uniquely to our profession. One of the unique identifiers of an AI is pattern recognition. They are very adept at identifying patterns from large data sets. Where else do you do pattern differentiation? TCM. The biggest value that TCM brings to the world is our way to pattern differentiate, to identify pattern differentiation and properly diagnose a syndrome, a pattern differentiation. Differs from biomedical sciences. This is why in TCM we say we don't treat diseases, we treat patterns, we treat syndromes. So there's a natural fit between AI platforms and their cognitive abilities and their skills, particularly trained skills to recognize patterns that otherwise we may not be able to detect, particularly in qualitative research, which we'll discuss in a little bit, and identify areas of exploration and areas of future endeavors within our profession that could really hone and benefit the research and education aspects of our profession. I've given you a link, by the way. You should by now have a posting in the chat of the handouts for this presentation. It's a PDF form, and I will let you view this short video on your own. It is kind of a summary of what AI has been able to accomplish in research so far. And it is truly amazing the kinds of work that AI platforms are doing. So when you talk about the application of these in our profession, there are very specific areas where they can benefit. And we're going to dive deep into that in the next slide. But first, I want to talk about the evolution of education. Education is evolving. We're on version 3.0 of education. And as the modalities, as the education concept itself varies and grows and evolves, it's driven by these three concepts. Digital transformation. We're in digital native world today. The new generation, even some of the older generations, such as myself, we have adapted digital transformation as a way of life. It has become ubiquitous, and it is a component part of our way of living. In such an environment, educationally changes the classroom, it changes the setup. Online classes, virtual environments, virtual interactions, e-learning components, these are all there now, and they're only going to get better. Number two, personalization and accessibility. You know, you don't have to go to a classroom at a certain city or a certain place and sit there for hours to learn something. You could be on your bedroom, you could be in your couch and learn the same technique. We have students at EIIHS from Ethiopia with satellite dishes learning TCM. That's a story within itself of how you can leverage this technology of Education 3.0 to reach the globe, the world, and to unite, to bring them together. So there are various elements of personalization and accessibility. Lifelong learning. There's no longer that concept of I finish high school, I go to get my degree, I'm done, that's it. I go to a job until I retire. No, the modern model of education is lifelong. You're learning at any age and you're continually learning. So that shift has empowered the evolution of education into version 3.0. And in version 3.0, artificial intelligence is playing a major role. Learning pathways that are personalized and self-guided, self-learning, tracking of student progress and giving them appropriate guidance at various steps, predictive analysis, effective research work for students who need to conduct their research, institution facilitation, and customized student support. At the Institute, our AI tutor can give virtual interactions with our students at the degree or at the level that they've studied with patient interactions, creating an entire environment for them to inquire, receive data, collect data, critically think, analyze, present a diagnosis and a point prescription and herbal formula, and then get feedback immediately whether they're right, wrong, or where they need improvements. This is a kind of self-learning platform, a social platform that is coming. Switching gears to research. What's happening within our realm is an explosion of open literature. There is a lot of research out there and a lot of material that manual review is just untenable anymore. There's now available mature research grade tools that leverage AI. We'll discuss many of them in our lecture today. Screening, mapping, synthesis, audit trails, all of these are tools that help ease the burden of someone trying to do even fundamental applied research or literature review or meta-analysis. There is clearer guidelines now. Before, about a year or two ago, there was no clear guidelines with regards to engaging with AI when you're doing research. There are now clear guidelines, and we'll discuss those in our lecture. And then ultimately, what does it boil down to? Your time is valuable. It's precious. Do you want to waste it on digging up research articles of 50 different places and then trying to read each one of them and extracting data from it, or seeing patients and helping them resolve their problems? And all of this, again, dealing with applied research. In TCM, our medicine is not well suited to the scientific method that is being applied today for most scientific research. Because in clinical trials, in RCTs, in all of these major research projects, they're looking at a very specific controlled substrate as their patient outcome measurements that they're measuring. TCM doesn't work that way. We're a holistic. So we are much better suited for qualitative research, and we'll discuss that in a little bit. So how does AI fit into this? From scoping to searching, to filtering, to sanitizing, analyzing that data, creating a synthesis, and then to provide you with draft material that you can work on. Every step, there are tools available for you as a clinician, as a student, to help you identify the proper articles, to filter them, to include, exclude them, to sanitize them, analyze them, and then synthesize content from them that can help you for your applied research. And applied research for us literally means what? Creating material that we can use to justify, to help promote our profession, whether it's to patients, lawmakers, policymakers, or fellow physicians who we want them to consider us for referrals. So that's really what applied research or pragmatic research really means. When you look at the pyramid, the research pyramid, and many of you have seen this, we've had this discussion in many other situations. At the bottom of the pyramid, they say, is expert opinion and case reports, which means they're not really that valuable. I disagree. I believe it was Vanderburg in 2001 who stated that case reports have a high sensitivity to detecting novelty and are cornerstone of medical progress. This is where things are happening in real life, in real world, in small clinics, where you're trying new things, where you're exploring new things. This is where innovation comes. So being blind to case reports and case cohorts, etc., is not conducive for our profession. Also remember that most of these case reports, observational studies, and even randomized control trials, some of them can be qualitatively measured, which is a much broader PROM-based, patient-reported outcome measurement, PROM-based reporting tools, which gives us a much broader spectrum as researchers to understand what's happening with the patient population versus big RCTs and meta-analysis or systemic reviews. Okay, so this is the key difference between how we need to look at research and applying that research versus what traditional research is. You know, when I say research to our first-year students, by their time of their graduate, they have to put in a capstone project. The minute they hear research, they glaze over, and it's like, oh my God, research, well, you know, and it doesn't have to be. If you understand what we're talking about with regards to pragmatic applied research, it makes sense. It is ultimately a tool that is beneficial for you in clinical life. And ultimately, what does it do? Benefits patient outcomes because you are informed and evidence-based. So the difference between those classic quantitative-based research versus real-world pragmatic research was discussed in the most recent case report masterclass from Research Task Force by Dr. Edward Chu. By the way, the second and third class are still available, so I encourage you, if you're really interested in learning how to create care-based proper case reporting in your TCM practice, go sign up. The class is still open. Reach out to ETCMA and see how you can sign up and begin your education. It is also a continuing education credit, I believe, that you can obtain. But the difference that Dr. Chu highlighted is there's a thing called efficacy and effectiveness. What is efficacy? In scientific terms, efficacy measures the success of an intervention under a strict controlled circumstances. Male, 17, no other problems, no complications, injury leg. We're going to do this injection and get this outcome. Very confined. It's not applicable in real world because your patients, not every patient of yours is male, 17, in perfect health. So it doesn't really fit in a pragmatic environment. So in pragmatic environment, you do effectiveness, the success of an intervention under real world circumstances. Real world settings with comorbidities, external validity, preserves the individualization. This is key for our profession. Every patient is treated differently because it is an individual. It's an ecosystem that is very unique to that individual. Disease manifests differently in that environment. You can't put it in a box. You can't be a reductionist like Western biomedical sciences and modern scientific thinking is, right? It provides you with realistic dosing, patient-centered outcomes, QOLs, qualitative PROMs, etc., rather than we've dropped the serum glucose level from this point to this point, right? Very narrow surrogate measurements. And then there are various other cost benefits, resource use data that you can get, and implementation barrier. To conduct one RCT will take 2 or 3 years. To do a couple of case reports and a couple of case practices, weeks, months at the most. And it does practice-based registries. It provides data centers and collected data, such as the one that the NCCOM is putting together right now through their AI task force, is collecting real-world data that then you can scrub for data that you can turn into applicable case tools in your practice. So when you have basic research, it asks the question why and how, right? It's basic fundamental research. How does this work? How does acupuncture work? Or why does it work, right? Then you turn it into a clinical application, exploring the evidence based on controlled environments. Not sufficient. You then need to go applied. How does that solve a real world problem that I'm facing with? So you're asking questions, what works here now for these patients versus does it work in principle, and why does it work, and how does it work? Population-based, it's real world, comorbid, age variations, gender variations, all of those, versus narrowly selected, idealized patient profiles, and the rest are excluded, right? Interventions, it's very tailored, it's multimodal, rather than you can only do this much by this much, you have to inject this much of this here and nothing else. You can't work like that in a real clinical basis. If you're a clinician, you know what I'm talking about. At every patient that you see, You're doing different things. You're doing different treatments with different modalities, depths, manipulation techniques, etc., depending on the real world situation that that patient is in. Outcomes. You're measuring patient-reported qualitative outcomes, function, satisfaction, versus cost, versus very specific biomarkers or surrogate endpoints that you're measuring. And then, like I said, timeline. You know, when you have a very rapid deployment cycle in case reports and applied research, you can turn things quickly around and see if it makes sense, if it's valid, and propagate it further. If not, it gets weaned off. So there are definite values of understanding applied research or pragmatic research and utilizing those techniques in your clinic, but taking the information that's been done and applying it in pragmatic research. Now, when you do this with AI, you have to be cognizant of ethics. And I've given you the 7 very important steps that you need to maintain if you're using AI. All of these are basically amalgamation of information that you can find here. All of these yellows are links to actual data content and codes from EU primarily that deal with GDPR Article 9, for example, for special category health data, for code of practice, for transparency, copyright infringements and safety, etc., and the official guide for ethics for trustworthy AI. These are all available downloads, documents that you can go and seek for yourself at your leisure. Human agency and oversight is number 1. We have to come last, which means everything that we obtain from AI, our eyes, our heart, our mind needs to finalize before it goes out. Technical robustness and safety. You can't trust on, unvetted applications. There are many of them out there, and be cautious because AI is such a hot topic. You'll get all kinds of announcements. Oh, this AI will do magic for you. Be careful, vet before you use. Privacy and data governance is very important. You're in medicine. Data privacy, according to GDPR or in the States, HIPAA, is important. You could be liable for disclosure of data that is injurious to privacy. Transparency and traceability. Any work that you do using AI platforms must be traceable, duplicable, and transparent. And there are tools that allow you to do that, and we'll discuss them later. Diversity, non-discrimination, and fairness, obvious. Social and environmental well-being, obvious. And ultimately, accountability. So keep these 7 steps in mind if you're integrating AI. Practical steps might be, I've used this platform to do my scrubbing, or I've used this version of this software to do my statistical analysis, etc. All right? So this is how you do AI integration. You don't use AI that is banned for high-risk purposes, social scoring, underrated biometric scraping, etc., etc. You do always oversight as a human. You don't paste identifiable GDPR 9 or HIPAA data into public AI platforms. You do document your AI use, the tool name, version, date, purpose, and your checkpoints, your transparency and record keeping. You don't present AI output as human work. No copy paste, Control-C, Control-V doesn't work. Always disclose use of AI and input from AI in your manuscripts, teaching materials, and student submissions. For those of you who are in my classes, protect student data. De-identify patient and student data. De-identify any data that is special category. Okay? Don't skip human validation. Always keep that in mind. I can't stress that enough. If you have citations, diagnosis, or safety elements, or point prescriptions, double check as a human. All right? We're still, Annie and Aggie are still prone to some hallucinations from time to time. Tell users when AI was used and to what limit and to what degree. Don't ignore versioning and provenance in AI platforms. If the model changes, upgrades, the data coming back will change. You'll hear me say this again later on. All tools are garbage in, garbage out. What you put into the tool is what you get out of the tool. This was something that was one of the fundamental laws of computing when computing was just in its infancy. So make sure that you are aware of the question you're asking or the kind of prompt that you're putting before you get the answer back. And that changes from time to time as a new version comes up. ChatGPT 4 was doing very different than 5.1 with deep thinking, et cetera, et cetera. And check for bias and fairness when your AI output affects people. Admissions, grading, clinical triage, right? If it suggests a certain thing, make sure it is fair and non-biased. So these are some do's and don'ts as far as the ethical use of AI in medicine is concerned. Now, let's get down to brass tacks. What is out there available for you today, both ANI and Aggie based? There is no ASI-based platforms, but there are some artificial narrow intelligent and general intelligent platforms out there. You're all probably familiar with LLMs, ChatGPT, or other versions that you're using, but there are unique platforms, particularly for research, that will be benefiting to you. Some of them we'll see in our live demo. Litmaps is a really good broad researcher that gives you a mind map style mapping of all of the research that's related to your PICO. And you can visually see that, navigate through that, and it creates almost a real world navigational tool for you to see how all of these different articles and research materials are connected together within the confines of your PICO, right? Of your basic question, hypothesis question that you're posting. There's Research Rabbit. There's Consensus. I'm going to show you Consensus, which is one of my favorite tools because it collects a robust data of information and does an initial scrub of the claims, and it gives you a very nice visual indication of how your hypothesis PICO has responded based on the research data that it gathers from all the different publications out there. Screening, prioritizing, there's Rayan, RevMan. These are tools available. Prisma 2020 is an AI tool that allows you to create a virtual map, a chart flow that gives you the inclusions, exclusions, relevance of your research articles. And it's almost essential if you plan to publish anything out there. The Prisma charts are very important. Cite and BibTeX are really good tools for allowing you to do citing, proper citing of any articles, etc., that you've done. And then the rest are more specific, like computer vision pipelines, right? At EIIHS, we have a tongue diagnosis AI app that we're developing. We have over 10,000 photos of tongues. We're collecting more. So if you have lots of tongue photos, send them to me. And we're training our ANI to look at a very specific set of diagnostic criteria for identifying TCM diagnosis as tongue, as a support, as an assistant, not going to replace your diagnosis. Remember what I said, human is the last word on all of these. Pulse signal analysis. There are now digital platforms like MATLAB, Python toolkits that allow you to explore waveform structures to help you literally attach a wristband and measure TCM pulse in a consistent basis. Because one of the problems that you run into in TCM, particularly in TCM education, you can put 10 masters together and 10 patients, and you'll have 100 different diagnoses of pulse based on perception. It's a subjective diagnosis, not really an objective diagnosis. And these tools can help you become a little bit more objectivized when you do a proper diagnosis, and other tools and components. So we'll be looking at litmaps and Consensus in the live demo. In education, even education, like I said, Education 3.0 has changed. We have AI-based learning, social platforms learning. At the EIIHS, we use Perusall, which allows you to basically send a PDF of, let's say, a chapter and have social conversation with your students. They can start annotating that, conversing through that, through the Google Classroom, which has AI platforms, and Edpuzzle. Edpuzzle is one of the up-and-coming educational libraries, video libraries, that allows integration of video content with real-time assessment that can identify the students' participation and degree to which they're internalizing and learning that material. And like I said, we have our own Chibo, which is an AI-based simulator and a tutor for our students. So there are a lot of interesting tools out there. We're not going to cover in this lecture the educational tools, since this is primarily focused on research. And what I'd like to do now is actually play you the short if you will, 15-minute, I think it's less than 15 minutes, recording of the actual demo. 10 steps, easy steps to productive use of AI in applied research. Let's listen to what I have to say. Hi, this is Dr. Akopyan. I'm going to now do a short demo, a 10-step demo of how to implement AI tools to assist you in applied research, in pragmatic applied research. If you're a clinician or a TCM student, and you want to leverage these AI tools that we've discussed in the lecture to support your efforts in doing literature reviews, um, analysis of available research, and then ultimately applying it in critical aspects by creating info packets, research analysis, summaries, as I said, lit reviews, etc. So step one, what we're going to do now is we're going to open a browser and go into a new tab. And I use ChatGPT, the ChatGPT 5 Pro version. You can choose other LLMs if you so are inclined to. And what we're going to do right now is create a PICO, right? And I'm basically going to instruct the ChatGPT to create a PICO on acupuncture for dysmenorrhea, primary dysmenorrhea, in relation to NSAIDs or other conventional therapies. And it's going to help me refine those elements, right? So I will type the text and we'll proceed from there. Okay, so the LLM will provide you with a comprehensive, depending again on the prompt that you have put in. There are many ways to improve your prompting in LLMs. Remember, ChatGPT, LLMs, AI is a tool. Tools in technology is GIGO, garbage in, garbage out. The quality of the question you ask is going to dictate the quality of the response the system is going to give you. So in that context, I do have other classes where I teach on methods and methodologies and systems to help you create proper prompts, detailed and specific prompts. But for now, we have a prompt that we can begin with. So what we're going to do is copy this prompt right from the LLM. Now we're going to go to step two. Step two is to use a research engine that we discussed, Consensus, which gives you a deep search into the available articles, available medical research, based on that PICO. So we go to Consensus. Okay, you'll notice that Consensus is similarly structured as a LLM. You're going to paste the PICO that you've created here, and you're going to do a dry run. Now, oftentimes, the initial PICO may return no results. This is sometimes due to the fact that there's a lot of detailed, meticulous information within the PICO. However, in this case, it looks like we are getting some results based on the available data. And the primary consensus from the consensus material says that 50% of the researched articles to about 20 sources have indicated that there is definitely a positive finding in that article with regards to the question that we posed. Is acupuncture better in reducing premenstrual pain versus analgesic and other primary care users? Now, this is our second step. Now, you could use this consensus map for illustration, for visualization, And you have a very detailed breakdown of all of the claims and all of the individual key evidence that comes in from consensus, and summary synopsis of all the articles that you have here. This is a really good source of information that you can begin your qualitative research in with regards to these articles to help you formulate your literature review or your research evaluation or summary, or even creating your info packets for your patients and or for referral physicians that you wish to work with. So that is step 2. Now, we're going to begin with step 3. In the consensus, you can share this link, this consensus link right here. Copy that link, and we go back to our project in LLM, in ChatGPT. I'm going to now request that ChatGPT create a summary from the following link. And I've pasted the link to the consensus finding into ChatGPT in this case. Now, you can see that based on the available research that was presented within the consensus, my request has been complied by a summary of what is the evidence from recent reviews suggesting acupuncture can provide pain relief, primary dysmenorrhea, etc., etc. So I have now a draft text that I can use for summary sheets or for generic opening statements in any research review documentation, or even in literature review, or even in info packet documents. Bear in mind, always human comes last. We must always accept this information as draft. Ultimate perspective belongs to the human, right? So this is step 3. Now, as step 3 or step 4, we're going to create a literature map, a lit map. And for that, we need to use the other tool that we've discussed in our lecture, and that is lit map. We're going to create a new lit map right here. We're going to add a new literature map. Well, let's call this dysmenorrhea. Okay. We're going to then select dysmenorrhea and add an article. This article is one of the primary articles, the DOI number of the primary article that we got from consensus or any other research database that we've used to collect data. So I'm going to add an article, and I'm going to go find my primary research. Okay. So I can mouse over, let's say here is a claim: acupuncture reduces menstrual pain versus baseline or sham. And this is a multiple RCT. And I can choose the number of articles in here that are related to that, and mouse over that, and I can pick the DOI. And that takes me directly to the DOI article. I can then copy that DOI right here. So I copy that DOI right here. And I go back to my lit review, and I add that DOI like right there. I will select that, and I will add that to my lit map. Generally, the more content you have in your lit map, the better in the correlation. I'm going to done here, and I'm going to add a new article here. Okay, add an article. Let's pick a few more articles here. Let's pick an acupuncture is superior to NSAID and COC. Some studies show. Let's grab this one. There's the DOI. Copy. Go to lit map. Enter. Add to dysmenorrhea. Okay. Let's go to another one. Let's see this one. Acupuncture improves quality of life. Let's take that one. Again, you can pick as many articles as you want. The more, the merrier, of course. Copy. You go to dysmenorrhea. We'll paste this here. Okay, now that we've added 2 or 3 or however many articles you have found in that context, you're going to create a lit map, right? And this lit map you have, in this case, I have a lit map called dysmenorrhea. I've added my articles based on their DOIs, distributor number, the DOI numbers. And now I will go in and view them and explore related articles. And this is really powerful because what it does is it shows you your primary articles that you've put in, and then it finds relatable articles and how they're connected. What is the referencing letters? What is the, how are they linked together? And you can view each of these new articles. So it allows you to explore articles. Now, there may be some situations where there's duplications. And this is why in advanced steps, in the presentation, I talk about a deduping agent that you can use, another AI element that allows you to do deduping. Because you can take this list right now, your articles, your list of your articles, and you can export them into either a bibtex or a RIS file. These 2 files, you can even export them into a CSV file, but these bibtex and RIS file can now be imported into other more advanced search content AI tools to allow you to dedupe, to sanitize, to find sightings, to make sure that claims are not duplicable, and also it provides you a list of the most relevant in context of that. Okay, so we have a map now. You can use this map as a visual assistant to you. You can click on each of the articles and obtain immediately relatable data, the years of these articles. And I usually include a copy of this map, of this lit map, as well in my research summary as an evidence to show how these articles, how these researches are connected together. Okay. Now, we get to step 7. We just finished the map. We're going to go to step 8. We're going to copy this map, and we're going to import it back to LLM again. So we're going to share with link. You're going to copy this link right here, and back to LLM, whatever your choice LLM is. And I'm going to ask my LLM to create a info packet for patients and referring physicians, applied research again, based on this link. Now, what this does, as it's doing its research, what this does is it creates an info packet that's relevant, that has extracted a lot of the information from the research materials you found, and with regards to treatment efficacy, with regards to dosing, with regards to referral conditions, age groups, PICO-based research. And it's going to present to me a summary, a nice summary that I can take and massage myself to create a referral document that I can hand to a physician, or a patient information packet document. So you can see the return, gives you a nice primary, what the definition of what is primary dysmenorrhea, how might acupuncture help, what does efficacy, the evidence say? So it gives you some historical evidential data based on the findings that we have. Is it safe for patients? What to expect, right? And also go back into for referring clinicians, indications for referral triggers, treatment parameters, outcomes to monitor, safety and counseling issues, quick documentation aid. So you can leverage these tools to assist you in your evidence-based practice. Idea being behind it is that most of this is mundane work that you would spend hours and days doing on your own. If you leverage these tools appropriately, properly, within ethical use, you can leverage them to do most of the hard work, the mundane work for you, and then allow you to use your critical thinking and your abilities to then integrate all this information into your clinical practice, ultimately benefiting your patients with patient outcomes and with your colleagues and physicians who may be wondering whether they should refer patients to you or not. Thank you for being with me, and thank you for staying in tune with the short demo. Okay. All right, let's go back here. All right, so the short little presentation, hopefully you guys learned some important news and tools that you can integrate into your clinical practice. I'm open for questions, answers, feedback. I'd like to know what you think of this. There's a short survey that's probably going out as we speak from our ETCMA host. Please participate. Take the moment right now to provide us some feedback. And also, how was the material? Was it beneficial to you? Did you learn something new? And there will be additional things coming in. We have additional AI in TCM tools and training programs coming in. For example, how to use Annie's TCM AI agent to do whatever you want. I have a student who decided, you know what, there's all this news that's propagating all around the world, and I want to be up to date on news relating TCM, whether it's political, governance, lobbying, or technology, intervention, invention, whatever, from all around the world. So she created an AI agent that scrubs the world and the World Wide Web every night and presents a beautiful screen with captures of synopsis of every major article from every region in the world of what's happening within the TCM field. She can dig deeper into each research or at least stay educated about what's happening in the profession. These are the kinds of tools that you can use. It's not about being afraid of AI, it's about leveraging it to help you. Okay, so thank you again very much. I will stop the presentation and open it up for discussions, questions, feedback, comments, anything that you guys are interested in talking. This is the time to talk about.